My biggest concern is that we're fighting this blind.
These are the words of Dr. Lin after completing his shift on Thursday, not only concerned with COVID-19, but also the possible repercussions of speaking out.
Yeah, I really had to think about this, the stress that it's going to put on myself, my family. I'm putting my career on the line here.
At the time of this interview, he didn't know the Thursday shift would be his last at St. Joseph's.
We're not protecting our staff very well. We're not protecting our patients.
Dr. Lin has arguably seen it all. He was working at a trauma center in Manhattan during 9/11. He explains the difference between working through a crisis like that and one like COVID-19.
And I remember feeling a sense of anxiety, waiting for the patient to come as the first patient came into our trauma center. And but the thing is that came and went, within an hour. And once you start working, you don't know. I mean, it just became just routine for us. But with COVID, you're sitting there, you're kind of waiting. You don't know where the enemy is.
Dr. Lin told us Thursday evening the biggest issues facing the hospital are a lack of PPEs for his staff, the lack of COVID-19 tests, and the long turnaround times in getting results.
So you can feel the stress among the staff and not knowing which one is COVID and which one's not. And also, our administration tells us specifically at one point, what to wear and what not to wear. They tell certain nurses and staff they can't wear a mask. And then they find out later on that the patients they were treating had COVID. And then they take it home to their family.
Dr. Lin says the hospital has had situations where a patient is treated for something non-COVID related, so staff was told not to wear PPEs, but it later comes out the patient did in fact have the virus. A representative from the hospital told us today it's true. If someone comes in for, let's say, a broken leg, staff would not wear PPEs the way they would if the person thought they had the virus.
If we do not conserve our PPE today, there may not be any weeks from now.
Knowing a shortage in PPEs is a nationwide issue, Dr. Lin says he's been in contact with numerous companies willing to help.
So I do feel as a community we can pull together and provide the adequate equipment that we need. But it's just rather whether Peace Health wants to take that initiative.
Staff with Peace Health said today they too are working with various companies to help decrease the PPE shortage. They also said today they received 48 ventilators and have a tent set up outside the hospital if it's needed. They said while testing is still limited, the labs they're using have been able to recently significantly improve testing turnaround. And while they would not address Dr. Lin and his termination directly, they did say this.
We really want to assure our local community about the medical center's readiness to respond to this health crisis. It's crucial that these facts get out because there is a fair amount of misinformation and assertions being made about the safety and the readiness of Peace Health St. Joseph's Medical Center.
Peace Health, who contracts emergency room personnel through Team Health, said they wanted to leave the commentary to them. A statement from Team Health sent to the AP did not explain Dr. Lin's departure from the hospital, but reads in part, "We are committed to engage with him to try to find a path forward." When we spoke with Dr. Lin Thursday, he said he knows we can get through this together, but it has to be okay to ask for help.
It's okay to tell the community, hey, we are not that well prepared. We need help. And the community will come together and help you. I saw that in 9/11. People will come and help you. But we have to be able to be truthful about it. We have to be able to trust each other.
Olivia Lavoie, Q13 News.